the 2023 modular update from the American Society of Anesthesiologists titled Preoperative Fasting, Carbohydrate-containing Clear Liquids with or without protein, chewing gum, and Pediatric Fasting Duration. So this pre-op fasting guideline is actually an update to a 2017 guideline. However, this 2023 update will include not previously addressed clear liquid type considerations, chewing gum, and the duration of fasting recommendations for pediatric patient populations. So this guideline was intended for healthy patients undergoing elective procedures. Now, healthy patients are those without coexisting diseases or conditions that may increase their risk of aspiration, and that includes esophageal disorders such as significant uncontrolled reflux, a hiatal hernia, Zenker's diverticulum, achalasia, strictures, previous gastric surgeries, gastroparesis, diabetes, opioid use, gastrointestinal obstruction, or acute intra-abdominal processes, pregnancy, obesity, and emergency procedures. With that, this guideline was developed using the grade methodology, meaning for each recommendation there will also be a strength of recommendation grading as either strong in favor, conditional against, and strong against, and there will also be a strength of evidence grading as either high, moderate, low, or very low. Now, the rationale for preoperative fasting is to minimize gastric contents, thereby lowering the risk of regurgitation and subsequent pulmonary aspiration. Now, with that, we have 5 new recommendations for preoperative fasting from the ASA in the 2023 update. Now, keep in mind that the ASA's 2017 recommendations still apply for pre-op fasting and the use of pharmacological agents to reduce the risk of pulmonary aspiration. But with that, let's go ahead and get into the guidelines. Starting with recommendation 1. For this recommendation, the ASA does recommend healthy adults drink carbohydrate-containing clear liquids until 2 hours before elective procedures requiring general anesthesia, regional anesthesia, or procedural sedation. The carbohydrates may be simple or complex, and this is a strong recommendation with a moderate strength of evidence. There is a consideration with this recommendation that up to 400 ml of clear liquid is considered an appropriate volume. Trial participants ingested a median of 400 ml of carbohydrate-containing clear liquids up to 2 hours before anesthesia administration. For our second recommendation, the ASA does say that there is insufficient evidence to recommend protein-containing clear liquids preferentially over other clear liquids 2 hours before elective procedures requiring general anesthesia, regional anesthesia, or procedural sedation. This does not have a recommendation, so there's no strength. However, it does have a very low strength of evidence. For our third recommendation, the ASA does suggest not delaying elective procedures requiring anesthesia, regional anesthesia, or procedural sedation in healthy adults who are chewing gum. This is a conditional recommendation with a very low strength of evidence. There is a note for this that chewing gum should be removed before any sedative or anesthetic is administered. And for our last recommendation, this recommendation from the ASA says that there is insufficient evidence concerning benefits and harms to recommend pediatric patients drink clear liquids until 1 hour versus 2 hours before procedures with general anesthesia, regional anesthesia, or procedural sedation. So this has no strength of recommendation as there's insufficient evidence with a very low strength of evidence. And there is one more statement from the ASA pertaining to clear liquid fasting in pediatric patients, but this is a best practice statement rather than a recommendation statement, so it does not have a strength of evidence grading or strength of recommendation grading. However, it does state that to avoid prolonged fasting in children, efforts should be made to allow clear liquids in children at low risk of aspiration as close to 2 hours before procedures as possible. In children with shorter clear liquid fasting duration, exercise your clinical judgment. And that wraps up the last of our recommendations from the ASA on the preoperative fasting, carbohydrate-containing clear liquids with or without protein, chewing gum, and pediatric fasting duration guidelines. For more information on this guideline and these recommendations, as well as our other clinical decision support tools and resources, make sure to visit us online at guidelinecentral.com or visit us on our mobile app, available on both iOS and Android devices. Thank you guys for tuning in. I'm Dr. Tabitha Michaud, and we'll see you guys real soon on our next guideline.